everyone. Today is a very hot topic of cannabis. So we're going to dive right into what the FDA already knows, since they have approved some medications that have the cannabis or marijuana involved in the chemistry of their molecules. So one of them is Marinol, which is actually taking the THC component of cannabis. Then we have a brand new one called Epidiolex, which is taking the CBD portion of the cannabis as an anti-seizure medication. We have Nabalone, which is taking the THC component, and that came out a little bit after the Marinol. And there has been Sativex, which is the combination of THC and CBD, and that's used for multiple sclerosis spasms, but right now that one is only in Europe, Canada, New Zealand, and a few other smaller countries. And there are a few others that are formulated and don't yet have trade names, but are having difficulty getting some of the approvals. Now, we human beings have our own endocannabinoid in our system, which is anandamide, which is a cannabis-like compound that is responsible for multiple conditions in the body concerning memory, thinking, pain, appetite, fertility, and several other conditions. And then we also have cannabinoid receptors. So we have CB1, which are the receptors mostly in our brain, lungs, liver, kidneys. And if you are binding these receptors, you may have some relief of your depression, pain, nausea, and that typically will bind best with the THC component, or is similar in binding capacity as though THC is binding to it. And then we have CB2 receptors in the body, which is a lot more immune-based, immune system support, appetite, inflammation, and also to a degree pain. And that is much more functional when the exogenous CBD oils are binding to it to create some of those effects. So we can't necessarily say these receptors are because of the cannabis plant that exists, but they exist for our own internal anandamide, cannabis-like compound, and the two are very similar, the exogenous plant and the endogenous molecule that we make. So I do want to give just a little bit of a disclaimer when I'm thinking through a patient who may benefit from CBD, THC, and cannabis in general. Cannabis has multiple different compounds within the plant, and the two that are notorious that we understand the most are THC, tetrahydrocannabis, and CBD, cannabidiol. And the THC is what a lot of us are familiar with, the buzz or the high that comes with smoking marijuana. And CBD is a lot of what is extracted in the oil base, which will not necessarily give you that high, but can affect some of those CB2 receptors in the immune system, appetite, inflammation, and pain, which we just previously described. Now, if I had a patient that I am walking through this concept, if that patient has any first-degree relative that has a lot of mental or psychiatric conditions that are prone to psychosis, THC is not an option for that person, because as an extra side effect per se, THC, especially when you are smoking the marijuana, will lower dopamine, and that lowered dopamine effect is what can cause some of the psychotic features that that patient is going through. But the CBD component, if it can easily be extracted from the plant, typically is safe with those patients. So we're going to get into all the different proposed benefits of cannabis on the human body. Now, the disclaimer also is, since cannabis is federally still illegal, it is difficult to get head-to-head studies with the plant itself. Of course, we have studies for those compounds that the FDA approved. So a lot of what I'm going to tell you has come from epidemiologic studies, has come from the NIH and the NIDA Association, which is trying to vet the most of this information thus far. But again, a lot of the studies would be ideal if they could be performed. We do have some mouse studies, and what I'm about to share has a lot of epidemiologic background. So number one, helpful benefit of cannabis. Now, some of this will be the interplay between CBD and or THC. Number one is chronic pain. I think a lot of us know about that. Going hand in hand with the chronic pain is relief of muscle spasms, and that is what the Sativex is capitalizing when it is trying to be used to take the multiple sclerosis patient out of the extreme spasms. Interestingly, we are discovering that there is the potential for cannabis to be improving our lung capacity, and thus far, we do not suspect that even smoking the marijuana is contributing to lung cancer unless there is a concomitant use of the marijuana with the tobacco user, with the tobacco being pro-cancer or pro-carcinogenic. It is pretty well known that cannabis can help lower the pressures in a glaucoma patient's vitreous pressures. There is clear evidence that cannabis can help in reducing epileptic seizures. And again, the CBD molecule has been extracted to create the FDA-approved medication Epidiolex. Cannabis can stop cancers from spreading. Thus far, there are some epidemiological studies, particularly so with brain tumor involvement. Cannabis can decrease anxiety in many regards and in many different anxiety categories. There is some budding evidence that, of course, we need to run studies on, that it may actually decrease Alzheimer's by slowing down the beta amyloid plaquing. And we are currently working on some mice studies that may propose a way that it can improve memory. Again, I will repeat that we have pretty strong support for diminishing pain, and the patient base that is being most studied is in our multiple sclerosis patients. Cannabis is also, interestingly, increasing the treatment effectiveness or the treatment efficacy from the antivirals that are treating hepatitis C. So those people who are undergoing hepatitis C treatments are getting improved, or we shall say diminished viral loading, if they are having some use of cannabis in their treatment regimen. Now, because of some of the CB1 and even potentially CB2 receptors, the research is starting to demonstrate IBS and relief of some Crohn's and inflammatory bowel disease for those who are using cannabis. And hold on to your hats with this one. Cannabis users are less obese, and they seem to have a healthier response to sugar management. Now, as far as the brain is concerned, cannabis can increase creativity. Cannabis can also diminish some of the tremors that we will see in a Parkinsonian patient. Back to the anxiety field of troubles, cannabis is currently being considered as adjunctive treatment for those with PTSD. And we also are noticing that post-stroke and post-concussive people who have been cannabis users casually may have an actually neuroprotective effect with those TBIs and brain insults. Now, where we have the biggest breadth of knowledge, especially in the FDA-approved Marinol, is with reduced pain and nausea for those people receiving chemotherapy, and the nausea component for the AIDS wasting syndrome is where Marinol and THC has its best effect. This one is a little bit surprising to me, but we are noticing that our cannabis users in one form or another seem to be cutting back on their drinking. And as I have often reminded patients, I have never seen a cannabis user alone be suffering from cirrhosis of the liver, which of course is what we see with alcohol users. We used to think that potentially the cannabis user may be using this and almost as a gateway drug. But since we have a breadth of knowledge and we are noticing the opioid crisis, we're starting to realize that there is the potential that those who are smoking marijuana or using the CBD component and getting some of their relief of their symptoms, we have actually cut back on opioid overdose deaths in this country. And that is a significant impact. And back to the pain treatment, since there is an opioid crisis, and since we are having a significant crackdown state by state as far as availability of opioids, and now we have manufacturers of opioids closing and losing the ability to manufacture their medications because of so many lawsuits, there just is not as much accessibility for opioids. So patients are almost forced to use anything other than an opioid to help with their pain control. And of course, for those states that are legal, the medical cards can grant them some pain relief. But for those recreational states, such as the state I'm in, people are using it to relieve themselves of pain because they have no access to opioids, and it is reducing opioid use in general. So, quickly, of course, there are proposed side effects, and the hippocampus gets involved when we talk about the smoking portion of marijuana and the THC as it affects potentially short-term memory. We think there is some social withdrawal and maybe some psychiatric disorders that I mentioned when the dopamine gets lowered. But as a reminder, this is typically not a gateway drug. And again, this is epidemiologic studies with some speckled information from the FDA-approved medications. There is a lot to learn with our mice studies. There is a lot to learn with other countries that have a few more medications that have run through their own FDAs. And I believe that there probably is a great niche for the cannabis plant. Again, it is similar to an endocannabinoid compound that we have, and some of the diabetic medications are capitalizing on the use of those CBD or the CB receptors for management of diabetes, and that's just one condition. So this is a conversation in evolution. This is a conversation in its infancy. I would love to hear of your experiences and any benefits or any side effects you have experienced with your usage of cannabis, how to get pure forms of CBD, and who is making the best and doing the best extractions is a whole topic for another day, because those things are not, frankly, FDA approved. And this is, again, the opening of discussions of this topic. Please subscribe to my channel below. And until we meet again, I'm Natalie Kunsman, MD, Integrative Family Physician. Until we meet again, be well.